The Lafayette Leopards honored the EMS people here in the Easton area, and John is going to talk EMS down on the field.
I sure am, Gary. Actually, it is First Responders Day here at Lafayette, so not only are we recognizing people here on the field, but in the stands and all over our community. You know, folks familiar with Lafayette understand that there's so much that goes on outside of the classroom. Lafayette is home to about 300 different clubs and organizations, not the least of which is the Lafayette EMS. I'm here with Rachael Broder, the president of Lafayette EMS, and our college's director of health services and college physician, Jeff Goldstein. Rachael, I'll go to you first. EMS Lafayette is a relatively new program, and talk to us a little bit about its inception and some of the things you guys do.
Right. So it was started in 2018. Camille McKedge, who was a senior at the time, she was an EMT and wanted to start getting involved on campus, and she knew that a bunch of other schools in the area had EMS organizations, so she went ahead and started to create the organization, reached out to Roger Demoreski, who's our advisor, who has been a huge support in getting this started. And basically what we do is we're a quick response service on campus. When there's a 911 call, we're in service over the weekend, we're dispatched to it, and we're able to cut the response time of first responders down by half. We get there usually in around 4 minutes, where an ambulance usually takes around 8 minutes to get there.
That is incredible, and I asked you about the uniform, and actually this is your Easton uniform. Right. Because your organization extends beyond just the physical borders of campus. You've done some work in the community. Talk about that a little bit.
Yeah, so we're actually a subsidiary of Easton Emergency Squad. When we were getting started, we were trying to decide whether or not we wanted to kind of be an independent organization or partner. And we decided to partner with Easton Emergency Squad, who's a very well-established organization with very experienced providers. It'd be a great opportunity to be able to work with them and learn from them.
As you search for your college choice and arrived, is this something you knew you wanted to do before you came, or is it something that was presented to you when you got here?
So I had wanted to be an EMT for a while because I hoped one day to be a physician, so I wanted to get involved early on. So I got my certification the summer after my freshman year, and I wasn't really sure how to get involved and use it because I had gotten certified in New York. And then an email went out, and I saw that they were trying to start an organization on campus, and so I immediately jumped on that and got involved.
Last question for you. Your student members derive benefits as well. Talk a little bit about what the students get out of this program.
Yeah, so I would say 90 to 95% of our members plan on pursuing a career in the health field. So being able to get involved early on in their career and actually work with patients, learn new skills, practice skills, is such a huge opportunity, especially for people who want to pursue things like physician assistant school, where you need patient contact hours in order to even get in the first place. So this provides a great opportunity to start getting those patient contacts early on.
That's incredible stuff. Let's move to Jeff Goldstein, and folks familiar with Lafayette have to be familiar with this gentleman. Jeff, as if you're not busy enough, you're on their steering committee. Talk about your interaction with the group.
Well, first and foremost, I just want to say how proud I am of Rachael and her predecessors getting this up off the ground. This was a huge, heavy lift, and something that over the time that I've been here for 19 years now, this isn't the first attempt at getting EMS started at Lafayette. This is about the 4th or 5th time that an attempt has been made to get an organization like this going, which I think is just so vital for our community. And thanks to the folks like Rachael and her predecessors, Roger Demoreski, I played a really small role in participating in the process, but it's been a real team effort. And talk about climbing the hill. These guys really climbed the hill like never before, and it's been a wonderful team effort. And Roger, myself, and others on the campus have been instrumental in doing something so important as this.
Very quickly, Jeff, talk about the interaction, because there are professional health and safety people on campus. This is a student group. Talk about the interaction between the two.
Well, they have more interaction actually with public safety than they do with health services. Pre-hospital care is really near and dear to my heart, as many of you guys know. I was an emergency medicine provider, back in the day, so I was on the receiving end of a lot of these cases that go from EMS pre-hospital to the hospital. And I will say without a question that they're having a huge outcome in taking care of our community. And it's not a matter of if, but when, they are definitely going to save a life in our community. Rachel was alluding to the fact that the difference between the response time of our local EMS and on-campus EMS, they've cut it in half. And so the time to defibrillation, for example, in a cardiac arrest, 8 minutes to 4 minutes, that's a matter of life and death, as other emergencies would be with things like airway and whatnot. So it's a tremendous boost to our community.
Jeff, I was going to ask you about value added. I think you covered it. And Rachel, congratulations on the whole program. It's tremendous. I know how valuable, vital, and Jeff, thanks for covering that. It's an incredible opportunity for our students and certainly a great service to our campus. Thanks for being with us today.
Thank you.
Gary, Michael, just another example of what goes on College Hill. Back to you guys.
Great job, John, with Rachel and Jeff, and thanks to them for their service for sure.